So I always wonder at events like this, I see faces that I know and I love, and I see some new friends as well. But I like to just start off by asking a question. How many people, this is your very first issues conference at UU Faith Action? Look at that, look at that. Kudos to you. And a huge shout out to Cherry Hill for hosting, for being such great hosts, for putting a team together that's helped to make this day possible. An amazing team, really, really on top of it. Really, really appreciate it. Let's go back to, yes, absolutely. Let's go back for just a moment to that question of what issues conference this is for you. So if you have been to more than, let's say, 3 issues conferences over the years, keep your hands up, and you can take them down when I hit your number. What about 5? About 5. Well, we got a handful there. How about, let's go 7. Let's go 10. Marty, I would think Ron would be right there as well, though, right? So this is part of the fun of this, right? Is the mix of folks who are both new and veterans to the work that we do, and ever expanding our circles. It's always great to have events at our congregations. Thank goodness we are at a point where we can do that again, because it's so good to be together. Now, let's get moving this morning. We have some chalice lighting words, which, yeah, come on up, Sue. And you read those, and I will try to light this thing. Okay. How's that work?
Good.
Are there?
There's okay. All right. Good morning, everybody. Hi, I'm Susan Druckenbrode, and Cherry Hill is my home church, and I'm also on the board of UU Faith Action. And Charles found me lovely opening words. The Sacred Power of Justice by Reverend Jamie A. Randall. We light this flame to ignite the sacred power of justice. We light this flame so that it may be a beacon of hope. In moments of uncertainty, fear, anxiety, and the unknown, we light this flame and are emboldened by its blaze. Knowing our strength as a prophetic and powerful people is rooted in the diverse ways we answer the call to love. Thank you.
I also just wanted to take a moment here at the very top to acknowledge that we live in a complicated world. And if you have been following the news at all, we see humanitarian crisis on top of humanitarian crisis. Let's just take a moment and observe a brief time of silence together. Silence for Israel and those who were attacked by Hamas, but also silence for the Palestinian folk who are now facing a threat of annihilation. As UUs, we can hold the complexity of the situation, but we can stand for our values. Let's observe a moment of silence together. Now, my grand pleasure to introduce to you our board president, Mia Morse, who has some opening remarks. Mia is a member of the Beacon congregation in Summit.
Thank you, everyone. It's so good to be with you, and I am just overwhelmingly happy to see all of you in person, online, and in continuing with what Reverend Charles said, I know at our breakfast table this morning, the discussion was about what's going on in the world, and at a time where things seem so overwhelming and so huge, and we feel that we may not be able to make an impact that really matters, remember that locally you can, and we are working towards those things today. So thank you for your time, your treasures, and your efforts in getting here today safely. I don't know about you, but in my house, we listen to WBAI Public Radio. Sally Gellert's on that channel, and our friend David Rothenberg. And he starts his program with this wonderful song, and it's, you got to start every day with a song, even when things go wrong. And so that's my partner this morning. I wake up singing, and I just give thanks because there are so many people that did not wake up with what we have. And for that, I am grateful. So I Googled UUA, social justice. What am I going to talk about this morning really briefly? And there's resources for justice, and I'll just quote, "Justice is the core of our faith. Our congregations are called to make a positive difference in wider communities. We work to serve, to raise awareness, and to support and partner with people who face injustice. We advocate, organize, and act for justice to live out the values of our faith." Does that sound familiar? All right. In the words of Audre Lorde, there is no such thing as a single issue struggle, because we do not live single issue lives. We live very complex lives, and that is what we're called to do, and working together. That was our discussion this morning together to also, like, how do we sit down and bring folks together community by community? We can make a difference, and we have to make a difference. The work we do together to build a world in which all are free and thriving is interrelated. When we ground our spirits, grow our skills, and act strategically for justice in deep relationship with each other and our movements, we choose to side with love. So to we will act in love, we will act on our faith, and we will bring each other together to work to move legislation in Trenton the best that we can, but we will side with love. When things are so frustrating and you're pulling your hair out, see, I've pulled all my hair out. I just can't take it anymore, and I'm yelling at the TV or the radio, and somebody's cutting me off in traffic, side with love. So thank you once again for being here. I look forward to working with you all, visiting your congregations, learning what you're doing, and working as a Unitarian Universalist with love. Thank you. Have a great day.
I have been so lucky for my time as executive director to have Mia Morse as the president of this organization. And I will admit, it saddens me to let you know, if you don't already, Mia is in the final year of her board term. So we will be looking at a new board president. I'm going to enjoy this wave as long as I possibly can, though. So will you give Mia just another round of applause? Also, I failed miserably at the start here of being as inclusive as I wanted to be, because I ignored all you wonderful people who are joining us online. Currently, if my numbers are right, I think we have about 30 people logged in to the Zoom meeting. That's great. That's really, really terrific. And just like in the room, it ranges the gamut of folks who are new, folks who have been here for a really long time, and folks who are finding their way somewhere in the middle. So thank you, thank you, thank you all for being here. And you know, we are really fortunate to have technology like this at our disposal, because for a statewide organization, it really does open up opportunities like this, where travel would just be so prohibitive for some folks to be here. So a good day for that. Well, we're going to jump right into the meat of the morning, because that's what we like to do. I get to introduce you to our keynote speaker, Roxanne Sutocky, who is the Director of Community Engagement at the Women's Center, an organization that she first began working with in 2013 as an abortion advocate and a community organizer. During those 10 years, her work has spanned the gamut of care. It has included direct interaction, helping patients navigate the myriad aspects of abortion care. And that includes financial and logistical and legislative barriers at every turn. She has served in a counseling role, working directly with those who are most impacted, but she's also worked to develop engagement programs for staff and patients and community members. Roxanne has said, this is a quote from Roxanne, that she holds a passion for developing and streamlining processes for community engagement, from social media and volunteer recruitment to strategizing and overseeing the organization's social networks. Based right here in Cherry Hill, based right here, right across the street. Roxanne plays a critical role, as does the Women's Center, in providing life-saving, life-affirming work. The Women's Center is dedicated to providing a warm, friendly, and inviting space that allows the patients the freedom to make pregnancy decisions surrounded by those who respect their choices. We need more of that in the world, don't we? Those who respect their choices. And we know with the Supreme Court's ruling to overturn Roe v. Wade, New Jersey remains something of a haven of abortion care, especially for those who do not live within its borders. There has been an influx of out-of-state folks who have come to New Jersey to get the care that they cannot get in their home states. And it's the Women's Center and organizations like it that help to make that possible. So I'm excited today. I'm excited to hear what Roxanne is going to share with us, because Roxanne brings not only the expertise of navigating these complicated legislative challenges, but she also always leads from a place of compassion and a commitment for justice. I call her an honorary UU for that alone. Please join me in welcoming Roxanne.
Good morning, everyone here, everyone online, hello. It's really nice to be back at UUCCH, our favorite neighbors to the Cherry Hill Women's Center. So, just hearing Mia, you say you use Side with Love. If you walk into any one of the women's centers, you'll see posted "Bring Only Love." That's something that we've said for a long time. I think there's a lot of complexities in the world. The issue of abortion is really complex, but when we approach this and all things, we lead with love as well. And so we're aligned there, along with so many other things. So as Reverend Laughlin said, I'm Roxanne. I use she, her pronouns, and for the last 10 years, I've worked in a number of different ways with the women's centers. I've also served on the board of the New Jersey Abortion Access Fund, which is our state's abortion fund. I currently co-chair the Abortion and Contraceptive Subcommittee of Thrive New Jersey Coalition, which I'll tell you a little bit about. I organize Cherry Hill Women's Center's volunteer clinic escort team, of who some of you are a part. Thank you very much. And I serve on the board of the New Jersey Reproductive Training Equity Initiative Advisory Board out of Rutgers. So I'm here today because, Unitarian Universalists are, as we've heard this morning, oriented to justice and to action, which is so important. working across issues that include, among many things, reproductive justice. And I was really grateful for the opportunity to speak with y'all today, and I was really thrilled to hear from Carol Escalzo, Ron, and get introduced with Reverend Charles Laughlin, because I know so much of the work of UU Faith Action. I've been working so closely with the Unitarian Universalist Church of Cherry Hill, but I've never been a part of the Issue Summit, and I think it's a really great opportunity to connect across a wide range of different issues that we're all working on. So yeah, as I said before, Unitarian Universalist Church, definitely our favorite neighbors, dedicated allies. They have welcomed me here many times over the years to organize rallies, to train volunteers, to host documentary screenings, to raise important funds for patients. Like really, every time we have a need, the Unitarian Universalist Church of Cherry Hill has stepped up to meet that, and it's huge. So I'm hoping just to use this time today to talk about abortion access, where we're at right now, what we need, particularly in the wake of the Dobbs decision, and lay out some actions that you can take to protect and expand reproductive freedom for all. Hands-on, legislative, advocacy, stigma, beyond. There's lots that we all can do today in the next couple of months and the next several years. So when I looked at today's agenda, something that really came to me was this issue of intersectionality, which is so important. And like Mia, I was thinking of the Audre Lorde quote about single issue, right? There is no such thing as a single issue struggle. It's true that our liberation is inextricable, and unfortunately, we share this opposition that is rooted in transphobia, in homophobia, in racism, in xenophobia, and in upholding economic inequality. And so it's really important that we fight all of these things beside one another and holistically. The Black women who developed the reproductive justice framework did so in Chicago in 1994. I think it's important to name and give credit where credit is due. So namely, we're talking about Toni M. Bond Leonard, Reverend Alma Crawford, Cynthia Nubile, Evelyn S. Field, Terry James, Bisola Marigny, Cassandra McConnell, Loretta Ross, Elizabeth Terry, Abel Mabel Thomas, and Wynette P. These women knew and saw the limitations of the prominent, at the time and still today, white-led narrative of choice, and they saw how limiting it was. These women named themselves the Women of African Descent for Reproductive Justice, and reproductive justice at that time was born. This is rooted in the internationally accepted human rights framework created by the United Nations. It combines reproductive rights and social justice. And at the core of reproductive justice is the belief that all women and people who can become pregnant, trans and gender nonconforming people included, have the right to become pregnant, the right to not have children, right? The right to have children, to not have children, and to nurture the children that we have in environments that are safe and healthy.
Amen.
And so today in New Jersey, we see deep inequities that are rooted in racism and systemic and historical oppression that manifest in a lot of ways that threaten reproductive justice, that are really well beyond people's ability to access services. The Sentencing Project says that New Jersey has the worst racial disparity in prisons in the country, with a Black adult here 12 times more likely to be incarcerated by a white adult. And when we look at reproductive health outcomes, we see similar alarming patterns. Black women are 7 times more likely to die from pregnancy-related outcomes than a white woman here in New Jersey. And so I'm really glad to see things like criminal justice reform, environmental justice, immigrant justice, and reparations today alongside reproductive justice, because these things are interconnected. These strategies can't happen one without the other. All of these things, right, are ultimately reproductive justice. Abortion bans are just one part of that, but the bans that we've seen, which existed well before Dobbs but have proliferated since, cause outsized harm for people of color. Women of color face more structural barriers to begin with when it comes to accessing healthcare services, and those inequities are exacerbated when policies further diminish their power and bodily autonomy. For people of color in this country, the denial and violation of bodily autonomy, unfortunately, again, nothing new, The United States has a long and disturbing legacy of things like forced birth, involuntary sterilization, and experimentation on Black and Indigenous women. So all of these things are related, right, to this denial of the ability to make decisions for oneself, the removal of this trust of the individual. Discrimination, unequal distribution of resources, and inequitable access to care do fall hardest on Black, Indigenous women, and birthing people. And because of the heightened and disproportionate maternal mortality and morbidity, it's particularly unconscionable to force the continuation of an unwanted pregnancy. And I know that restricting access to care is just the beginning. We see that the fall of Roe has continued to be followed by a wave of criminalization, attacks on clinicians and people who can become pregnant. And we anticipate an increase in people being criminalized for their pregnancy outcomes and even their behaviors during pregnancy, again with a disproportionate impact on communities of color and immigrant communities who are more likely to be surveilled and policed. And so for these reasons and many more, we fight for equitable access to care here in New Jersey and beyond. So for those of you that are unfamiliar with Cherry Hill Women's Center, again, we're the clinic right across the street. We're part of a network of providers that's called the Women's Centers, and we have 5 clinics in 4 states. We have our Hartford GYN Center in Connecticut. We have the Philadelphia and Delaware County Women's Centers in Pennsylvania. We have our Atlanta Women's Center in Georgia, and our Cherry Hill Women's Center here in New Jersey. We also host an advocacy center, which is a group of folks that really just work to schedule appointments, help people to figure out all the logistical and transportation needs, and overcome all of the barriers that exist, whether it be a ban or a waiting period or something else. So we were established in 1978, and we are an ambulatory surgical center facility. We are specialists, so we provide medication abortion, but also procedural abortion care in the first and second trimesters of pregnancy to day through 28 weeks. Each year, our independent clinic serves thousands of patients, ensuring each person who walks through the doors will receive excellent individualized care. And we're an independent clinic, or sometimes it's called an indie. These types of clinics actually provide 3 out of every 5 abortions that happen in the United States each year. And independent clinics stand resolute in our provision of care in hostile environments for those facing the most significant barriers to services, and particularly for those who need care later in pregnancy. Abortion past the first trimester is almost exclusively provided in independent abortion clinic settings. And Cherry Hill Women's Center is one of very, very few sites where abortion is provided at all in southern New Jersey, which makes us a destination from women in our state who are traveling from as far as Cape May, and of course, in addition to the rising number of patients who are coming from out of state that we serve. We're also targeted by anti-abortion extremists, both from in-state and out of state. In fact, today you may have seen members of the Columbus Baptist Church who made their monthly demonstration outside of Cherry Hill Women's Center today. An action that in the past has included busing dozens of people to stand in front of the center, to yell at patients who are seeking care, to harass the staff, to videotape and live stream the activities at our healthcare center, and deploying large, disturbing signs featuring graphic and offensive imagery, which has included swastikas, photos of genocides, and lynchings. With so much hatred and violence perpetuated by those who are claiming this moral high ground due to religion, we're really truly grateful to be wrapped in love by the UU faith community. So we don't just provide medical care. In addition to our work as medical care providers, the women's centers are also committed to serving as advocates for equitable access to care. So we provide education, we facilitate opportunities for activism, for people to get involved in this movement for reproductive health rights and justice, and we fight legal battles on behalf of our patients and our communities. Importantly, we train residents, nursing students, a skill that is not taught in most medical programs, the skill of providing abortion, and even sometimes just working with folks who are experiencing pregnancy ambivalence, right? Pregnancy options counseling. And we participate in research to better help understand the complexity of abortion and the importance of equitable access to care. And in New Jersey, we help to facilitate the Thrive New Jersey Coalition, of which UU FaithAction are invaluable members. We bring together over 80 organizational members from across the state to collectively advocate for issues related to sexual and reproductive health. We have subcommittees actively working in 4 focus areas: maternal justice, sex education, menstrual equity, and abortion and contraceptive access. We also support related issues, such as our previous support for the expansion of driver's licenses, regardless of immigration status, right? Which allows patients from southern New Jersey counties to be able to get to us, particularly our migrant worker communities. Working to draw accountability and attention to conditions in New Jersey prisons. All of these things, again, that interconnectedness and intersectionality being really at the center and the core. So I want to talk a little bit about where we're at, right, a year post-Dobbs. I'm going to skip over my section about abortion basics and sort of assume that y'all have gotten the information about breaking down sort of misinformation and myths about abortion, and just start with, the reality of sort of where we are at today. So in June 24th of 2022, the Supreme Court issued the ruling that took away the constitutional right to abortion. It abandoned almost 50 years of precedent when it did so, and it paved the way for states to ban abortion. So right now, today, abortion is outright illegal in 14 states. If you live in Idaho, North Dakota, South Dakota, Oklahoma, Texas, Missouri, Arkansas, Louisiana, Mississippi, Alabama, Tennessee, Indiana, West Virginia, Kentucky, you are living under a full ban. There's also additional states that just don't have any providers, right? So we're talking about huge swaths of the country that not only don't have access to reproductive health services, namely abortion, but also are increasingly at fear of criminalization for even seeking that care. They're living with a provider community who is fearful of giving information about folks' options. There are an additional number of states who have banned abortion well beyond what would have been legal under Roe, and that includes Utah, Arizona, North Carolina, South Carolina, Florida, and Georgia. So I mentioned we have our Atlanta Women's Center in Georgia, a clinic that pre-Dobbs was one of our busiest facilities, serving upwards of 6,000 patients every year, both from Georgia, but also from the surrounding areas. Atlanta is a transportation hub. Fairly, easy to get to, right? For folks in surrounding states where there already were bans in place. And that access to care there has just been decimated. We can essentially provide care up until about 6 weeks of pregnancy, which is just barely beyond the point by which most people know they are pregnant at all. So today at Cherry Hill Women's Center, we're seeing patients from Georgia, but also from all across the country. New Jersey has actually seen about a 14% increase in the number of patients who are coming to our state for abortion, or just a 14% increase in sort of the number of abortions overall. And what I can share is that Cherry Hill Women's Center's patient population has shifted so that about 1 in 5 patients right now are coming from out of the state of New Jersey. That includes patients who are coming from Pennsylvania. Neighboring PA actually has a really long history of obstructing access to abortion, and still, although abortion remains legal through 24 weeks, has things like a 24-hour waiting period, forced parental consent, a ban on Medicaid coverage, right? Access is not easy. We have TRAP regulations that closed nearly half of clinics, and the state actually only has 17 providers left at all. And so a high number of the out-of-the-state patients that we're seeing are from PA, but others in the last 3 months alone have been from Ohio, Delaware, South Carolina, Florida, and Georgia. And right now there are additional states who have bans that are enjoined, who have bans that are pending, who are working on ballot initiatives to try to protect abortion care in their state, and others who are still trying everything in their power to eliminate any abortion access at all. So this has been a rapidly changing, shifting landscape, even for somebody who talks about this issue fairly frequently, who works in this field every day, it can be a lot to keep up with. I have sort of slides that sometimes I'll share that show the maps that every time I give it has to be revised because something has changed. And I think what we know is that for patients and people who are seeking care, it can be really a lot to keep up with. It's very confusing. Folks that are calling our advocacy center are telling us, that they don't think that they can get care at all, that they're very fearful about what the potential outcomes can be. And I've even talked to student groups, both outside of the state and also even here in New Jersey, who've said they've tuned out from the news. They can't listen to it, they can't keep up with it. It feels so disheartening, they feel so disengaged. It just seems like only downward trending, only downward trends are happening, and they feel like there's nothing that they can do. So a lot of, what we do is what we're gonna do today, which is talk about how you can get engaged, what you can do to make a tangible difference. I can share that in anticipation of the Dobbs decision, Cherry Hill Women's Center did quite a few things. We expanded our gestational age offerings from 24 weeks and 6 days to 28 weeks. Many of the people that we are seeing travel from out of state have faced significant barriers, from finding out that they're pregnant, to seeking abortion care in their state, to being denied, to then having to figure out things like childcare, time off of work, transportation, lodging, and the cost of care outright. So we are seeing particularly increasing numbers of people who are traveling out of state for that abortion care later in pregnancy. We hired additional staff at our advocacy center. We employed our first patient navigator, who really just specializes in sort of being like a travel agent for people seeking services, a language access director to improve the ability for people to access information, scheduling support, and all the things that we know are necessary, and trying to, again, diminish some of those inequities in that access. We've seen a huge proliferation and a sort of taking advantage of all of this chaos by people just widespread putting misinformation out there about abortion, about the legality, about what people can access. We've seen anti-abortion centers taking advantage of folks, offering themselves as free resources, as unbiased centers for people to come to, including in banned states, but even here in New Jersey. And then bringing people in, giving them disinformation about what is available to them, what are the potential outcomes if they have an abortion. So right now, even in a state that has done a lot of good stuff, and I'll talk about that, there still are a lot of challenges to overcome. So I mentioned New Jersey has done some good stuff. I'll lay a little bit of that out. In the years leading up to the Dobbs decision, we did a handful of things, and that was a big part in partnership with our Thrive New Jersey coalitions and UU FaithAction. But we worked to petition the Board of Medical Examiners to update the regulation around abortion. So for many, many years, New Jersey had basically TRAP type restrictions, and TRAP means targeted regulation of abortion providers, that were abortion exceptionalism. So those are things that treat abortion much differently than any type of medical care without any proven increase in patient outcomes, patient satisfaction, really just serving as another way to push care further out of reach for folks. So successfully, the state eliminated a lot of the more burdensome restrictions about who could provide abortion care and where abortions could be provided, which actually allowed us to do that gestational age expansion and pave the way for providers other than physicians to provide procedures and medication abortion earlier in pregnancy. So right now the state is working to develop a training program for advanced practice clinicians for whom early abortion care is well within their scope of practice, but for no reason other than abortion stigma have been barred from providing that care. So we're expanding the types of providers that can see folks and the types of facilities that are available to individuals. We also extended our clinic hours. So we, from the time that I started working at Cherry Hill Women's Center, provided care Tuesday to Saturday. Saturday is always being our busiest day because majority of people, who are working don't have the ability to take time off of work, particularly paid leave. We extended that to Monday through Saturday, and we moved to doing 10-hour days. So we had to really expand our staffing to allow for that, but we are able to see both an increasing number of patients due to that and accommodate the much higher need patients that we're seeing, right? Folks who are needing care later in pregnancy, folks who are coming to us with significant traumatic histories, and folks who are coming to us with a lot of comorbidities, right? We're seeing patients who are coming from states where it's not just abortion care that's been restricted, right? Abortion care has been made illegal, but access to healthcare, to healthy food, to housing looks a lot different here in New Jersey than it does in places like Kentucky and Tennessee. And so we are, really shifting a lot of the ways in which we provide care that have always well been beyond sort of the actual abortion to really treat the holistic needs of the person. But we are seeing people with much, much higher needs now in the wake of Dobbs. New Jersey also passed a bill called the Freedom of Reproductive Choice Act. Some of you all might have been involved in the campaign to push the Reproductive Freedom Act. That bill didn't pass. What did pass was the Freedom of Reproductive Choice Act, which did some really good stuff. It enshrined the right to abortion into our state statutes, essentially protecting abortion rights for the future. It also required that the Department of Banking and Insurance conduct a study about the need for insurance coverage for abortion care services. And that study has happened. It showed that there is a need for coverage, particularly a need for affordability in access to care here in New Jersey, and has led to some changes from the Department of Banking and Insurance to extend and essentially mandate coverage of abortion care for all state regulated plans in New Jersey. New Jersey has a pretty good landscape when it comes to coverage. We're one of the states that has pushed back against the Hyde Amendment at the federal level, which bans any federal funding for abortion and eliminates Medicaid coverage in most places. But New Jersey, Medicaid actually does cover for abortion. Still, there's a lot of people who have private insurance policies who have no coverage at all, who insurance is denied. This fixed that, right? It said you can't just say no abortion, but we'll cover everything else. Unfortunately, a lot of those people, because of the shifts that have happened in the way insurance sort of covers healthcare generally, have really high deductibles and high copays. I can't tell you the number of times I've talked to somebody who are like, I have great insurance, I called my insurers, I know it's going to cover for abortion, the cost of their procedure out of pocket is $500 and their deductible is $2,000, which means their required out of pocket payment is $500. They might as well not have insurance at all. So again, work to do. We also know that there's a lot of people for whom there is no path towards traditional insurance coverage, right? People who immigrate to the United States may have delays in their ability to access any type of public benefits or even private insurance. And there are people for whom their legal immigration status eliminates any path towards insurance at all. Almost immediately after Dobbs, the New Jersey legislature passed a couple of bills that are shield protections. And so what these legislation did were start to build some insulation around the care being provided here in New Jersey. The legal landscape, like I mentioned, is sort of in this very chaotic place right now, with abortion being legal some places, illegal other places. As United States residents, we have a right to travel. We have a right to movement, which essentially means you can and should be able to travel to anywhere in the United States and enjoy the legal landscape of that state. You can go to Las Vegas and you can gamble, right? You can come to New Jersey and you can buy legal marijuana. But right now, in the ways that the shifts are happening with abortion, there's some question about, can you cross your state's lines to access abortion care in a state where that is legal? And we're looking at places who are increasingly trying to do things like enshrine fetal personhood into law, paving the way for a future where abortion is the crime of murder. That looks a lot different, right? We've also seen states like Missouri try to take steps to actually ban their residents from being able to leave the state to access care. I think the opposition has been particularly successful when it comes to stopping the movement of young people who are seeking abortions. And there even was a resolution out of North Texas that happened on the local level that basically said, you can't use our roads to drive out of the state to get an abortion, right? Because they were seeing people leave Texas and drive into neighboring Arizona. So New Jersey did a couple of things so far. We've created some protections for medical records, right? We know that HIPAA should protect our medical records, but when it comes to a criminal or civil investigation, there were some gaps that we've closed. We've done things like eliminate the opportunity for the extradition of a provider if an investigation is launched in a place like Texas. We're not able to extradite someone from New Jersey who is a provider to Texas, which is hugely important not only for protecting these individuals who have dedicated their lives to providing abortion care, but also like maintaining our ability to continue to provide services in places like New Jersey. We also have instituted a non-cooperation policy, which means New Jersey's courts, New Jersey's state agencies will not cooperate with an investigation into an individual or a provider's activities that are legal in New Jersey when it is related to reproductive health care. So these are some really big and important provisions that have passed so far. And New Jersey joins about 14 other states that have taken these proactive steps. And a lot of this, unfortunately, is still really theoretical. It's untested, but we are doing as much as we can to sort of make a foundation that we think will hold up in court when we start to see some of these investigations and court cases really coming down. We think that it's sort of they've been slow on the uptake of that because the folks who pushed a lot of these bad bans saw the pushback on that during the elections, right? We also are doing a lot to just expand access to contraception, right? So we signed a bill that we hope will come into effect probably by summer of next year that expanded over-the-counter access to contraception, so provided by pharmacies. And that will be available to New Jersey residents at the pharmacies, but also for people outside of New Jersey who come to New Jersey pharmacies. So just thinking about a lot of the different ways that we can sort of approach this issue. And so right now, even in a state like New Jersey, abortion access relies really heavily on community support since there are so many geographical and financial barriers that abound. There are a lot of things that you can do. I'm going to name a few. When it comes to direct funding of abortion care makes a huge difference, right? I think Roe, right, when abortion was illegal, there were places where people could get abortions and only people who had money could get to them. And now post-Dobbs, again, we're looking at a world where, abortion is legal in a place like New Jersey, but if you don't have any money, if you don't have a strong support system, that is not accessible to you. So abortion funds like the New Jersey Abortion Access Fund, like the Abortion Liberation Fund of Pennsylvania, exist solely to collect dollars and hand them to patients that need them. They're paying for things like abortion services, for plane tickets, bus rides, hotel rooms, childcare services, all of these things to actually enable access to abortion and to try to make sure that these harms that we know are going to have the biggest impact on people living in rural areas, young people, poor folks, people of color, that we can try to level the playing field a little bit. So direct donations can go to abortion funds. They can also go to clinics like Cherry Hill Women's Center. You can host fundraisers. You can even just tell people that these funds exist. Some people don't know about this framework, and I think it's important that people know that affordability, regardless of the legality of care, is still an issue here in New Jersey. You can also be a clinic escort volunteer. So I mentioned that there are some folks in this congregation here at Unitarian Universalist Church of Cherry Hill who are clinic escorts at Cherry Hill Women's Center. There are a couple of programs for volunteer clinic escorts in the state. There's one at Cherry Hill Women's Center, and there's one that helps out 2 clinics up in North Jersey at Englewood and I believe Pilgrim Medical Center. So clinic escorts have a pretty straightforward job. It's helping people to actually get into the clinic when there are opposition protesters outside. These people can make it really nerve-wracking to get into the center. I've talked to folks who have straight up turned around and left because, they are so concerned about being identified by members of their community. They themselves are at risk of violence because of an interpersonal violence situation, and they see a video camera, they're afraid of being identified. People who are coming from out of state in places where abortion is criminalized are concerned about this sort of surveillance in addition to just the harassment. And so clinic escorts wear an easily identifiable rainbow vest, put a smiling face on, stand outside, they show people where the door is, and say, come on in. Right? Sometimes just having someone there to make eye contact, to be like, it's okay, right? Like, this is not normal, but this is the normal for today, and I can help you, right? It makes a big difference. The protesters also act much differently when someone has eyes on them than when someone does not have eyes on them. And I always say that in addition to the direct benefit of easing the experience for people who are seeking abortion, who have already overcome a lot, and decreasing the burden on the clinic staff, it also does a lot to break down stigma, to just have people standing outside here on Kings Highway that are like, I support abortion. I'm here because I want this to be available. I want people to get this care. And I don't want, the opponents to be the loudest voice in the room, which unfortunately for a very long time they have been. Yeah, yes. We also have been working on creating a network throughout the state, and Cherry Hill has been a part of this, of creating post-abortion care packages. This is also something that has an immediate direct benefit to both the patients at the center, but also the clinicians. When we're overworked and people are under-resourced, to just be able to hand somebody something that is free, that will help them. It does a lot for our to keep our spirits up, right? But it also has a tangible benefit to the patients. Things like menstrual pads, right, that people need after an abortion when someone has overcome the cost of travel and a hotel room and the procedure. Sometimes it's something that just is like out of reach, and that alleviating that little bit of a burden to make those pads available, or to give a pair of cozy socks for somebody who didn't come up with like adequate footwear, right? Like, these things make huge tangible benefits, and it just shows people that like folks care about them. People are really feeling, I think, the impact of all of the negative rhetoric around abortion, the impact of like seeking care that is criminalized, right, in your home state. So these little acts of kindness go a very, very long way. In the policy realm, I think I would have a lost opportunity if I didn't remind folks that there's an election coming. By nonpartisan get out the vote efforts are happening throughout the state. League of Women Voters, ACLU will be having really low lift text bank options to remind people that there is an election. When the governor's not up, when the president's not up, sometimes people don't turn out. But every seat in the state legislature is up for grabs this year, every single seat. We have a repro website bill that made its way through the legislature that is waiting to be signed by Governor Murphy. This will establish within the Department of Health a landing page where people are able to see the resources that are available to them, up-to-date information about the legal landscape of abortion in our state, and referral information for providers within the state, which will help to combat the fairly well-resourced marketing and advertisements of these anti-abortion centers throughout the state. And we have a bill that we have the opportunity to pass during the lame duck session, which is magical time between Election Day and the start of the new year, where outgoing lawmakers sometimes will take a chance on policies that they would have been a little bit more scared to push. And so I think we'll probably be talking today about a lot of these things, but one of them is the Reproductive Equity Act. It has a lot of provisions that were included in the original Reproductive Freedom Act that have not been passed. There is removal of some laws that are on the books that could potentially lead to the criminalization of someone at the end of pregnancy. There is an increase in funding for abortion care for all, regardless of immigration status and without copay. There are additional clinic protections, doing things like enshrining the Freedom of Access to Clinic Entrance Act, sort of improving our ability to protect ourselves from some of the more violent extremists that are outside of the center, and finalizing some of the shield work, doing things like protecting providers' malpractice insurance and increasing protections for telemedicine provision of care, which is potentially a path for increased access for people in some of the banned states from here in New Jersey. It also secures some of the funding that has been made available through the last couple of years' budget cycles for things like security grants for providers, training grants, and facilities improvements. And in addition to policy, I think fighting back against stigma and fighting for culture change, also extremely important. Each and every one of us has a platform, whether that's the folks at our kitchen table, around the breakfast table, Thanksgiving coming up, or you have a blog or a social media, platform, a website. You have the ability to share accurate information, which right now is needed more than ever. You have the ability to share your story, whether you're somebody who had an abortion themselves or whose life was impacted by access to abortion, and to share just your support for people who are seeking abortion, people who are providing abortion. Again, often the opposition are the ones that we hear most frequently from. I believe I'm going a little over time, but I think I started early, so if I have...
You're good.
I'm good? Okay. I'm getting there, I promise. So at Cherry Hill Women's Center, we have a quote on the wall from Rabbi Sofer that says, "No woman is required to build the world by destroying herself." Yeah, powerful, right? Everyone who walks through our doors is experiencing really unique circumstances. And like I said, we trust every person to know what's right for them. Since I have a few moments, I'd like to share the story of a patient who really generously told her story with us and allowed me to share that with you. So at that time, my sickness was worse than usual, more violent, more insistent. It was normal for me to wake up with cold sweats and vomiting, but that time it was different. Whatever was causing it would have to wait. However, I had things to do first. The most important activity in my life was getting to what I called well. And in reality, I was the furthest thing from well. My heroin addiction was in absolute control. I needed to get a bag so I could feel normal, or what my idea of normal was at that point. I could no longer get the euphoric high from heroin, only the absence of physical withdrawal and a bit of the numbing of my mind. It had been so long since I could pass for a functioning member of society that truly normal was beyond my capabilities. I had to do whatever it took to get another, and that was the only thing I knew. I ate from garbage cans, I got arrested, and at times I was worried about where I would find a safe place to sleep. I woke up in ambulances, from overdoses, each time wishing I had been allowed to die. I hated what I had become, but I didn't know how to change, and I was without hope. I went to a clinic, and they confirmed my fear. I was pregnant. I asked about alternatives, hoping there was an easy solution, but there was not. The closest program that accepted pregnant addicts was a few hours away, but the wait list was months long. I chose to terminate. Despite the clouded thinking of my addiction, I knew that was the better choice. I was not capable of caring for another, especially for those critical 9 months in the womb. I could not even keep myself safe, and I knew everything I did or experienced would be visited on my developing embryo. The procedure itself was physically painful. I could not afford sedation, but the emotional pain was truly haunting. I felt completely worthless, knowing I was incapable of caring for a child. I did not feel a maternal bond. I thought that because I did not feel guilty for choosing abortion, I must be some kind of monster. However, I have come to learn that I was not alone, and I had nothing to feel guilty about. It has been almost a decade. I have a new life, and I know I am not, nor have ever been, worthless or evil. I am clean and sober for over 7 years, and the junkie I was has disappeared and has been replaced by a passionate, empathetic, and upstanding member in the community. I have since married, become employable, and traveled the world. I volunteer with several local organizations every week. And when I went back to complete my undergraduate education, I found that I love learning and excel as a student. I'm now attending Rutgers Law School on a scholarship. My aim is to use my legal education to help those who feel like I once did, trapped, hopeless, and worthless. I'm grateful that I have had the opportunity to access a safe and legal abortion. I try not to speculate on the alternative, other than to know that it would be grim. Today, my past does not define me nor hold me hostage. It drives me to speak out and share my hard-earned truth and strength and compassion that I have gained. Abortion is not sinful, it is normal, and it is critical health care. So I share that, right? Yeah. And I think the patient who will remain unnamed was really generous to share that with all of us. But just to say that no two people's experiences is unique. No one ever anticipates that they will be in the situation where they have an unplanned pregnancy, where they might need an abortion. And I think a lot of the opposition, and a lot of times even in our own hearts, we can speculate what we think should be permissible, what is not. And really, we can't imagine, we can't walk in other people's shoes, but we can lead with love, we can lead with kindness. We can assume that people have the best intentions, that they're doing the best that they can with the tools that they have, and we can meet people where they're at. So a lot of, the way that I see abortion care, it's harm reduction, right? It's making this procedure, which we know can be life-changing, can be life-saving, accessible to the people that need it. And we know that so much more work is needed. There's so much work to make sure that people have access to resources when they're experiencing active addiction, right? That people have access to clean water, clean environments, housing, food, all of these things that they need to be able to choose to grow a family if they want to. We never want to see somebody who's having an abortion because they don't have the tangible resources that they need to do so, and that they don't really want to have an abortion. But that's the reality of survival for a lot of people, particularly people who are in low-income households. And so, I appreciate the work that FaithAction does to enable access to abortion wherever possible, enable access to contraception so people can plan their pregnancies to the extent that they can, and also just remind us that this is one piece of a big web, a lot of things that need to change, so that we can really find, this idea of reproductive justice where everybody has the things that they need to build the families in the way that they want, and to raise those families safely. So thank you so much for all of this time. I really appreciate you for welcoming me this morning. And I'll be here for a little while if y'all have questions or anything during the break. Thank you.
Just so you know, when we send out the post-conference survey, we're going to make sure that we include the link to the Women's Center so that you can give of your generosity to them as well. I also just want to say this, because the work you do, in my theology, is nothing less than sacred. Thank you for what you do. All right, so this is the moment where we're going to take a really quick break because you probably need to stretch, or maybe you need another cup of coffee, or who knows, maybe there's a restroom somewhere that you're looking for. But we're going to try and keep this short, so please come back as close to 5 minutes as you can so that we can keep this thing moving forward. So up next, as I am sure that those in this room and those online are aware that in recent months, New Jersey, like so many other states across the nation, has seen a rise in contentious local board of education meetings, where some hateful and vile policies have been championed. And those policies, let's be very clear, they are directly targeting the rights of trans kids. It's a political stunt, but it's effective for the opposition. So one of the very first emails I got when this started to happen was from Reverend Rosemarie Newberry, who wrote me and said, "Hey, do you know this is going on? What is FaithAction doing about it?" And I was able to say, our Reproductive Justice Task Force has this on their radar. We were already expecting some of this with the sex ed curriculum, but it shifted in tone and it shifted in demeanor. And one of the things that's challenging about this is these meetings often come up very last minute. There isn't a lot of lead time, and that's intentional, right? So that political hay can be made. I asked Reverend Rosemarie to come speak to us a little bit about what her experience has been attending some of these Board of Ed meetings, because I know that she has gone to many of them. She has her finger on the pulse of this, and I thought we could take a few minutes to hear from her, not only about what the experience has done, but some practical examples of maybe how we can get more involved. So, Reverend Rosemarie.
Hi, it's great. It's great to see you all. I'm trying to figure out how to look at the charts and then also look at all of you and wherever the camera is too. So, Charles and I came up with different titles, which doesn't mean he had keep schools safe. I think that's a good one. I just had a more general keeping up with BOEs. There's my name, my phone number, my email. If you want to contact me, I wanted to make sure you all had that information. Next slide, please. So what I'm going to say is they're chipping away at trans rights. I'll go into a little more detail on the next slide, but what you're hearing, and if you see a lot of the BOE signs from people that are running, you will see parental rights and educational excellence. Those are code words, and you need to know that those are not the people that I would support. And I think it's a shame, but there's a history of parental rights and the words around parental rights. One of them, which was alluded to today, was underage women or underage girls requiring parental consent. And that was all couched as parental rights. So they're reusing that. And it's also around the issue of sex ed in schools and can the parents opt them out of sex ed. So you will hear parental rights and it is anti-child. Okay? So you need to watch out for that term, parents' rights and parental rights. Now what I want to also let you know that this anti-trans activities and the requirement, because it's all what's happening right now, this instant, is it's all around the issue of do teachers or administrators or counselors inform the parents without the child's consent. This is nationally driven. This website that I have here has listed all the towns in the entire country that have what they call anti-parental rights policies at the BOE level, and you can go down New Jersey and you can find which ones they're targeting. Now, New Jersey, let me just set that up in a little bit because it's on the other chart. But this is a national thing. This original list was published in March. So they are clearly going after children's rights and children's safety. And I also think that they're setting this up to distract us from issues like Black Lives Matter and reproductive access, or reproductive freedom, or reproductive justice. I wasn't sure which words was, and having us forget about that. So, hey, I'm for parental rights, and you're going to start hearing it not just at the BOE level, but you're going to hear it at the state level. And the stuff that comes out of their mouths, except for this, they say parental rights, you go, yeah, I'm for parental rights, but you don't know what's underneath that. And they say educational excellence. If you go on this website, they'll talk about all this educational stuff that they're supporting. Well, all of us would really want to support that. Got to be really careful. They have figured the opposition to children's safety and our trans children's safety have figured out what language to use and make it confusing for voters. Next slide, please. So what they're specifically going after is a Department of Education guidance policy called 5756. When this started up, when the first town BOE brought this up, there was the AG immediately had filed suit against them. And then I go on vacation for 2 weeks in September and I come back and all of a sudden this policy is not mandatory, it is now optional. And this is the really scary part because there's nothing to stop it if they have the votes at the BOE level. Now, this is a 2017 policy. Why is it coming up now instead of earlier? There's a timing on it. And 500 of the 600 plus school districts, their BOEs, have approved it. So there's 500 that we're going to see possibly that are going to be out voting. It takes 2 Board of Ed meetings. They've got to have 2 hearings before they do a final vote. These come up fast. They come up real fast. And it seems like they all have their meetings on the same Wednesday night. And so you're scrambling to get people, the people that you want to be organized with to get to attend these meetings and testify. So the couple in Monmouth County has been a concentrated effort in it, and it makes me sick. So I have listed Howell, Middletown, Marlborough, Millstone, Old Bridge, I think Manasquan, in addition to Freehold, Homedale, and Colts Neck. What did I just do? 9 towns in Middletown. Once one started it, then they talked to each other, and then it all showed up and started others. I list down there other towns, if you can see it in the room, but other towns that are in other counties. I didn't look up what counties these are in, but you might know some of these towns that they're in some process of repealing the policy 5756. This policy is an entire policy that gives trans youth protections. The part about the parental guidance is just one sentence in it. The way it's set up, they can't edit. They have to throw out the entire policy. What you're also finding out when you're there is that they are saying, well, LAD protects them, so we don't need to have this policy, or our children are doing fine. And as Reverend Lauren McGrail, she's a friend of mine, and we've been working this issue together, says this is a new effort to undermine the rights of the LGBTQ community for all these children. So they are starting here, but they're going to go a lot further. And BOE is also a starting point for these people to move up into legislature at the county level, at the state level, and even at the national level. You got to keep eyes on what's happening local. And so, next slide, please. I wanted to give you a few kinds of steps that you could take. The League of Women Voters in Monmouth is doing a dialogue tomorrow at 3 p.m. and they advertise it as transgender children rights. So you know how that discussion is going to lean. Vote and campaign for children's rights. Ask your local BOEs what's their status on the policy of 5756. You know, there's 100 plus out there that didn't approve it. So what's going on with them is something that we could query. Partner with other faith groups. Lauren at UCC, one of the board members said some really derogatory remarks about that congregation, that this was at Homedale and the congregation's in Homedale. So their next meeting is next week. A bunch of us are going to come and say we stand beside her, even though we're not a church in your direct community, we're beside you. Garden State Equity has been trying to keep on top of this. That with the change for it to be optional as opposed to mandatory has thrown them all in a loop. At the Homedale one, they said, yeah, and even Garden State Equity isn't here. Well, yeah, they were in Freehold at another location. I know at one time we had 4 Monmouth BOEs voting on the same night. So that's a real problem, and they know it. So that's how they're showing up there. And I'm hearing that FaithAction is going to start an LGBTQIA plus group. And I think joining that and together we can work on these issues. That's what I have to say. That's my update.
Sure. But come up to the microphone so that people can hear you.
Hi, good morning. My name's Carol Washler. Oh,
Larry, is that one connected to the Zoom, or does she need to come up? Okay.
okay. From UUC Princeton. And so this is my issue very much. What I know is that there is an attempt to get legislation that can be worked in the lame duck session that will put the transgender guidance from the New Jersey Board of Education or Department of Education into law. So that's one thing, so that people can't say, oh, it's just guidance. And the other thing is there is an excellent poll that was commissioned by the New Jersey Education Association, a little bit of a counter action to that awful Monmouth University polling institutes thing that put awful stuff out into the atmosphere. But this poll, and you can find it on njea.org, is I think the first item that comes up on it. Take a look at it because it has excellent language in the way the questions were asked. It will help us to use that student-centered, child-centered language to talk about this. Thanks.
Thank you, Carol. The one thing I want to add here is we think this is going to continue and increase because this is a political tactic that is about something very different than the issue that they put out there. I also want to say this because I believe this from the bottom of my heart, from talking to so many LGBTQ UUs, but especially trans-identified UUs. Many of them feel like we are failing them now. They feel like we are not stepping up at their hour of need. When we say things like, well, it really isn't that bad in New Jersey, that is so dismissive of what's going on because it is that bad in New Jersey. No one's dignity should be questioned. We don't know how to solve this problem yet. We're trying to get creative. We're trying to figure it out. We're looking at it. There are challenges here. There are big challenges. But we have to show up for this. We have to show up for, even if it's not your community, showing up to show your support is essential right now. Because, folks, if we let our trans-identified UUs down, if they feel like we don't have their back, That is not a good look for us, and that is not how we center love. More to come on that, I can promise you. All right, we're a little behind, so I'm going to move us ahead a bit. You know, one of the things you know if you're a veteran of multiple issues conferences is so much of what happens today is centered around the task force breakout sessions that are going to happen this afternoon right after lunch, right? So each of our task forces is meeting, and you can pick a task force to go and hear their presentation. These sessions are important because each task force considers what are the really pressing concerns for advocacy, for education, and for mobilization in our communities and in our congregations. The fact that you are here today likely means that you feel a particular affiliation to one of our task forces. But you know what one of our challenges is as an organization? Sharing the big picture. It's so easy to get stuck in our silos, so you only know what this task force is doing because that's the one you attend, right? And getting the message out, you know, one of the things that frustrates me to no end is that UU Faith Action is a hidden secret amongst so many of our UU congregations. There's just not enough awareness. And I'm preaching to the choir because you're here, right? You very much care about this. We have to find ways of getting that information out. So I'm going to go over a quick rundown of each of our task forces to highlight some of the things that we know we're going to be working on, with a special emphasis on the upcoming lame duck session, because I want you to go back to your congregations and talk about this, right? That's how we build more support for the organization. Our congregations need to know, in a nutshell, what the issues are we're working on. And as we talked about earlier, it's intersectional, right? It all blends together, and you can't really separate these things if you're going to do the real work of dismantling systems of oppression. We have to find a way to work all this together. So let me take a really few moments here. I'll have to cut some lines as we go. So this is going to be a fun part. First, our criminal justice reform, and this is in alphabetical order, so I don't want to hear anything about me playing favorites. First, our criminal justice reform task force. It is chaired by the fabulous Tom Moran, who's back there in the back of the room. Key issues for this task force include reform of policing in New Jersey, ending life sentences for older incarcerated individuals who have served long periods of time, continued work with the Department of Corrections ombudsperson to make New Jersey prisons more humane, right? There was a recent bombshell report that was issued from the Ombudsman's office that details the out-of-cell time and length of time in restricted housing for those in isolated confinement. In short, all of the men's prisons in this state are woefully out of compliance with the Isolated Confinement Restriction Act, which is an existing law. We got the law passed, and the prisons are ignoring it. We've got to do something about that. The task force also continues to explore the issue of fully abolishing slavery by ending the exception clause to slavery that's in the 13th Amendment, because it says that if you've been convicted of a crime, you can be essentially enslaved or face indentured servitude. There's so much going on in this task force, and during the lame duck session, we anticipate possible movement on some bills. I'll mention a couple. One, to establish civilian review boards in target locations in New Jersey, something that we've been working on for a really, really long time. Some real hope that we're going to get those civilian review boards at least for some cities in New Jersey. So keep an eye out on that. There is the bill that I mentioned for resentencing of the older incarcerated individuals. You'll hear this referred to as the Second Look bill. And there is a bill to make telephone and video calls free in the prison systems. The exorbitant rates at which the incarcerated are forced to pay just to maintain contact with their family, it is immoral. It is absolutely immoral. Go to our website, you'll find more details. Moving on. Next task force, environmental justice, chaired by the amazing Peggy Middow, who's right back there. The Environmental Justice Task Force is taking on 4 what they're calling action groups, and each group addresses one element of the overarching task, and that task is to reduce the impact of climate change on our health and the ecological systems of which we are a part. Each group takes action steps such as making calls and writing postcards and testifying at hearings, all to move towards a cleaner, healthier, and sustainable New Jersey. You're going to hear more about the push for a green amendment in New Jersey. You're going to hear about multiple bills that support clean energy and energy efficiency. A more recent focus of the task force has also included promoting regenerative agriculture in the state and working on food security issues. So, and the task force is committed also to legislation that would protect and expand public and urban forests. So EJTF believes that there will likely be movement on several of these key bills during the upcoming lame duck session. That lame duck session, so we have an election coming up in November, right? The lame duck session starts on November 20th, and it runs through, I think, January 9th. During that time, there's a lot that's going to move, so I need you to be prepared. We're going to be sending out action alerts, oftentimes at the very last minute, because that's the way things roll. And not only are we trying to get good things passed, we have to fight really, really hard to keep some awful things from getting snuck into the lame duck session. So keep your eyes and ears peeled for that. The Immigration Justice Task Force, co-chaired by Marty Rothfelder and Ted Fetter, emphasized their work in coalition with many groups. New Jersey Alliance for Immigration Justice is one of the primary coalition partners, which itself is a coalition of member organizations. They also work with partners that are from the nonprofit public interest groups. So these are things like ACL New Jersey, the New Jersey Policy Perspective, First Friends, and the American Friends Service Committee. They have key partnerships with immigrant-led organizations such as Wind of the Spirit, Casa Freehold, New Labor, and Make the Road New Jersey. They work in coalition because, not just because it's more effective, but because doing it that way centers the voices of those most impacted by this work. Recent efforts of the task force have included increased focus on refugee support, which is happening in many of our congregations across the state, particularly work with IRISE, which stands for Interfaith Refugee and Immigrant Services and Empowerment. What's going to happen in the upcoming lame duck session? Well, IJTF is working to see movement on 2 bills in particular. The first is the Values Act. The Values Act would allow immigrants to get services from state and local governments without fearing that that information was going to be shared with ICE. We really want to get that passed. The second is a language access bill that would ensure that key forms and directives from the state are translated into more languages to be more accessible. Why wouldn't we do that, right? It's a really basic accessibility issue. More details on our website. The Reparations Task Force, led by the remarkable Ron Hine over here. For the Reparations Task Force, it is our UU 8th principle of journeying towards spiritual wholeness by working to build a diverse, multicultural, beloved community by our actions that accountably dismantle racism and other oppressions in ourselves and our institutions. That is the guiding vision. That is why we want to have the conversation about reparations. The signature legislation here would create a task force at the state level, the New Jersey Reparations Task Force, that would examine the issue of reparations in depth and then make recommendations based on its findings. Well, guess what we have found? There aren't a lot of legislators who are on board for this. They seem to be fighting it every step along the way. That has led the task force to realize that in this moment, more of the work needs to be in the educational aspect of the work that we do, right? The advocacy we're still doing, but we need to do more education. We need to be having conversations about reparations in every congregation in this state. They need to be in-depth conversations. They need to reflect our values. Come be a part of the Reparations Task Force. Figure out what you can do to promote that message. All right. The fifth and final task force is Reproductive Justice, co-chaired by Carol Escalzo and Jamie Thal, both who are on Zoom with us this morning. That task force has 4 committees working on abortion access, sexuality education, maternal justice, and menstrual equity. The Abortion Access Committee is working toward passing legislation during the lame duck session that you're going to hear more about in just a few minutes that would expand access to abortion care. We do have strong protections in New Jersey. You heard part of that this morning, but we need to expand our rights to ensure that everyone has access. People who are uninsured or underinsured, people who are undocumented, young people, those living in rural communities, and LGBTQ plus folks in New Jersey should have access to abortion care. The work of the task force is intersectional, and they recognize the overlap with so many of our other task forces. Members of the team are active members on various committees of Thrive New Jersey, as Roxanne was sharing a little bit about this morning, which is a statewide coalition of organizations working collectively to promote sexual and reproductive health, rights, and justice through policy change and advocacy. So, those are our task forces. When you hear it, even in that 30 seconds spilled out all at once so there's no way you could follow everything, aren't you proud? Aren't you proud? We're doing good work. Collectively, we're doing far more work than you would think an organization of our size was capable of. And there's so much more we could do if we got the message out to our congregations. Please talk about UU Faith Action. Talk about us when you're at coffee hour. If you see someone who you know cares about a social justice issue, invite them to come to a meeting. Invite them to get involved. If all of our congregations and communities were more aware of the possibilities of the work we could do collectively, of the work we are doing, and of the future work we are committed to do, we could surely move the needle towards justice in this state. And speaking of commitment, we are so grateful for your presence and your generosity. Your generosity of time and talent and treasure. And I'm going to invite Marty Rothfelder, who's going to come up and say a few more words now about how you can show your generosity today.
Hello, everybody. How y'all doing out there? Great. I am indeed Marty Rothfelder, and it's a pleasure to be here with you in Cherry Hill. It may be dreary outside, but inside here we have the pleasure of a happy, spiritually uplifting programming and welcoming place for our conference. I thank those of you that are here and those of you that are online, wherever the camera is, and I thank our hosts for having us. I hope you're inspired by what you've heard today and will hear later today. Is anyone out there inspired? Yes. All right. And we hope you're moved and have been moved and will be moved with the conversations with task force members, staff, volunteers, coalition partners, other attendees about the work that needs to be done and that is being done. How many of you also think there's a lot more work to be done on these issues? Okay, so this is a particularly insightful group, and I think that you will recognize the need for resources to make this organization run. But did you know that the vast majority of our budget, which I think is around $240,000, our monetary resources come from individual donors?
Yep.
Okay.
70%.
Okay, thank you. I needed a little help on that one there. The dollars and the volunteer time are what enables us to do the important work that Charles has done quite a job of summarizing much of it. Well, I've done this pitch a few times at this group, and I usually ask for 10 or 15 minutes. But I know today with this exceptional group, I only need 5. I ask you to consider the issues that we're advocating and mobilizing on. I ask you to harness the inspiration of today and turn it into generosity, yes, donations. One-time donations are great, and we're prepared to take checks, cash, and credit cards. Mira will be out there taking all that. There will be a QR code up there that you can do. So every type of way that you can give will pretty much be here available to that today. It's all to make it easier for Faith Action and being generous easier for you. We particularly appreciate it if you would do a pledge or an ongoing monthly contribution, but we love the one-time donations too. We'll take it. We also happen to accept auto donations, stock donations, and some have been kind enough to consider us for the bequest in their wills. So finally, I'd just simply like to thank all of our donors for entrusting us. Many of you, I'm sure, have donated in the past, and I hope you like the habit of doing it and continue it today. Without you, we would not be able to continue our important work of education, advocacy, and mobilization on the front lines of the policy arena. Now, the person before me that did a lot of these pitches also told me we needed a break right after we give this pitch so you can give money. But this, again, is an exceptional group. We're going to do one more thing before we have a break. And I know that you want to go out there and give Mira your credit card, but I know you can wait 10 minutes for the next activity, and then we'll have a little time before lunch and a little time after lunch where you can carry out your desire to be generous. Thank you for listening to me today. Thank you for all you do. Have a great rest of your conference.
Thank you, Marty. So we are almost on schedule, but as Marty was just saying, there's something really exciting. This is one of the things I've been most excited about for this issues conference. The staff has been colluding together for some time on this new program that we're launching right now. You're going to help us launch a new UU Faith Action initiative right now in this very room and online. We're calling this Action Hour. And we want to thank UU Justice North Carolina, which is our sibling state action network in the great state of North Carolina, because they're the ones who first talked about creating this program in their state, had massive success with it, and we've been figuring out how we can learn from their example and adapt it for what we need to work. Here's how it's going to work, right? How it's going to work going forward, we're going to have a Zoom meeting the first Friday of every month. It's going to be scheduled at 12 noon, right? And we're asking anyone who can come to show up for that Zoom meeting. And while we're there, we're not going to talk about all kinds of issues and deep things with legislation. No, we're going to spend that hour actually taking an action right then and there. No preparation is necessary. You show up, you give us your time, you take an action, you feel better, and we move the needle of justice forward. What we're going to do is provide a Google document that will have all the instructions necessary for you to take an action. Action? What kind of action? Well, an action could be almost anything. It could be making phone calls to key legislators to express your support for a bill. In that example, we briefly outline the talking points, provide you with a sample script, and then while we're on that Zoom call, you'd put yourself on mute, you'd pick up your cell phone, and you would call your legislator's office right then and there and leave the message right from the script that we have. Or maybe the action is writing a letter to the editor about a particular justice issue. So we'll go over key talking points for a particular thing, and during that time, that 1 hour block, we'll work on letters to the editor. We'll help each other out. We'll write them. We'll get you the information about who they need to go to, and we'll send them off. Simple, straightforward, but effective. And another possibility for an action is that we invite key coalition partners. So maybe the Women's Center wants to come to one of our action hours because they have a particular action that we could take together. We are open to suggestions for all the things we can do here. This work will cross our task forces, because you're not committing to just one task force. You're not even committing to have to show up every month. It's a come as you are able, a drop in as you are able, and do something good on that particular day. And here's the thing, you don't have to prep. You don't have to commit to every single first Friday. Come as you are. That's what we want to do. Oh, but you say, I can't join you on a particular Friday at noon because that just doesn't fit into my schedule. I say, no problem. The Google Doc, which you will have access to, will have all the information on how you can take that action at a time that is convenient to you. And in fact, it will be set up in such a way that it would be really easy for you to share that action with your faith community or your congregation, and then, like the little ripples in the pond, we're spreading the work, we're spreading the impact. So we're calling it Action Hour because it's about action. So it's going to start on First Fridays, but actually it's going to start right here and now. So we're passing out postcards right now. Everyone should be getting 2 postcards, because if you look at it, one is addressed to Senator Sutocky and one is addressed to Assembly Speaker Coughlin. This is a call asking them for the Reproductive Equity Act that we heard a little bit about earlier today. We need them. Here's what's happened. The bills got introduced and they've gone nowhere because the leadership of the legislature doesn't want to schedule committee hearings, which are necessary in order for the bill to move forward. If you sign these postcards and include your address, we're going to then take them back up, we're going to put stamps on them, and we're going to send those out, because we're letting the Senate President and the Assembly Speaker know that we want to see action on this bill during the lame duck session. We can do this during the lame duck session. Legislators are more likely to take a chance during that time. If you are at home, you too can take this action. There's a QR code here. If you scan that with your phone, it will give you the link to the Google Doc that we're talking about, which will be an ongoing document of these actions. So you can find the information and you can click in order to send an electronic message to Sutocky and Coughlin.
Or if you don't want to use your cell phone to navigate to the Google Doc, type in bit.ly/first-Fridays. It's written there under the QR code. So for folks on Zoom or anybody using a desktop computer or tablet, you can also type that link into your
and
browser.
we're going to have these links up on the website as well, so don't worry if you can't grab it this exact moment, right? But you will be able to get to it. And again, this Google Doc will be kind of cool, because one of the things North Carolina found is it's just a running list of all their action hours. So it's sort of a great resource for going back and seeing lots of things that have been done. I'm very excited about this, right? So you scan the QR code, you go right to the Friday Action Hour Google document, you have an action for that day or whenever you're available to take that action, and you take that action right then and there. There's also going to be at the end of that Google document a quick report back form. This is to help us track what's actually happening. So if the action hour is to make phone calls to legislators, that form just allows you to quickly tell us how many phone calls you made on that day, or how many letters you wrote, or whatever the action is. Super easy, super simple. So mark your calendars for November 3rd, 12 noon for our first Friday action hour, but you got the pre-First Friday action hour in the room today, right here and right now. Thank you.
Some people only got a Sutocky and some people only got a Coughlin, so please raise your hand if you're missing one, and one of us will help you. Thank you.
And also, we have more of these postcards. Take them back to your congregation, your family, your communities, distribute them. Because here's the thing, this has to get resolved in the lame duck session, because if it doesn't, the bill numbers are going to change. Right? So like if this bill has to get reintroduced in January, the bill numbers that are on those postcards will change, and will most likely be looking at 2 more years before any action is taken. So it's really imperative that we do this quickly, right? And that you share this information. Now, Couple of quick things. We're 5 minutes behind time. We're about to break for lunch. After lunch, the task force breakout sessions will start at 12:30. We're going to have a slide up here that shows you the breakout session assignments, the room assignments for the various breakouts. The breakout sessions will go from 12:30 until 2 o'clock, although they may end earlier if the task force finishes up its work. But we're inviting you, those of you who are here in person, to come back together down in the fellowship hall at 2 o'clock. We're going to have really quick closing words, but then we're going to have an opportunity for some conversation, for some connection, and maybe best of all, some cookies for the drive home, because at that point, we're all going to need a little sugar pick-me-up. So for those of you who are attending online, now is your time to enjoy your lunch. We'll open the Zoom breakout rooms around 12:15, and the session starts at 12:30. Thank you for a wonderful morning, and I look forward to lunch and a great breakout session afternoon. Thank you.